Inflammation is the commonality between just about every health problem under the sun. So whether you're talking about autoimmune conditions, chronic fatigue syndrome, anxiety, depression, Lyme disease, co-infections, reactivated viral issues, mold toxicity, what is the commonality there? It's an inflammatory response of the immune system. Inflammation is a product of the immune system. So inflammation in itself inherently is not a bad thing. It fights viruses, it fights bacteria, it heals our body. Healthy, balanced inflammation is quite important. But it's when inflammation is thrown out of balance, that's when problems arise. So chronic inflammation is really this commonality, but it's a commonality, it's not a true causation. Now, chronic inflammation can create other problems because the body's interconnected. So, for example, inflammation in the gut can cause a ripple effect of inflammation in the brain. But we have to ask the question, well, what caused the inflammation in the gut? Or whatever example you're talking about. So yes, it's a commonality, but it's probably not going to be a true causation because we have to ask the question, what is causing the inflammation in the first place? So that, to answer your question, it would be looking at foods, because every food we eat either feeds inflammation or fights it. There's no benign meal. But because of biological individuality or bioindividuality, because of everybody is created differently, there's not going to be a cookie cutter approach. So I could have 100 patients with fibromyalgia, and the food protocol for one person is not going to be the food protocol for the next person. And that's a larger question too. In functional medicine, labeling somebody with fibromyalgia or chronic fatigue syndrome or any autoimmune condition, that's just explaining their symptoms. Like, yes, someone with CFS is chronically fatigued, but why? Somebody's going through fibro, why? So we want to actually go upstream to say what's causing that. We know there's a set of symptoms, and the ICD-10 code is going to be the same, but what's driving it for one person isn't necessarily driving it for the next person. So foods are going to vary based off of that case. And that's going back to health history, labs, and determining the next steps to that. And then that food protocol will evolve over time too. So if somebody is like doing like a GAPS, like a protocol at the beginning, like a gut and physiology or gut and psychology, like type food protocol, they're not always going to be doing that. So we use it for a time, medicinally, therapeutically for a time. But when they start healing the gut and untangling the inflammatory cascades, then we can lean them into other things. So that's important to say too, that the food protocol somebody does at the beginning is not going to be there forever. So what's the transition look like? And when is that transition appropriate as we get the person feeling better? We have to look at the other things that drive inflammation, foods, and then there's a lot of non-food issues there too. So part of that is just generally looking at the gastrointestinal system and the microbiome. Yes, food plays a part of that, but there's a lot of gut problems that are food's a part of it, but not the totality of it. So looking at things like SIBO, small intestinal bacterial overgrowth, food reactions, of course, food sensitivities, food reactivities, histamine intolerance, oxalate problems, salicylate issues, like these food reactivities. And that's all in the presence of gut-centric components of inflammation. So higher calprotectin, lysozyme, and then intestinal permeability, leaky gut syndrome. And then of course, any yeast or bacterial overgrowth, we look at that. That's a driver of inflammation. And of course, you can't really have a conversation about inflammation and not look at where the predominance of the immune system resides, which is in the gastrointestinal system, 75% of it. So there's a lot of underlying gut problems that's causing inflammation systemically. So we want to look at the microbiome and then look at non-gut components to inflammation or drivers of inflammation, like chronic infections. So that could be Epstein-Barr virus reactivated, cytomegalovirus, human herpes 6 virus, a lot of other viral issues that could be found on labs. Then we could look at tick-borne problems, Lyme disease, Borrelia burgdorferi, and Babesia bartonella, these tick-borne co-infections. And heavy metals is another component of it. And then mold. Obviously, biotoxins are another component of it. So these other non-gut-centric components to immune stressors. The analogy that I use is like if someone had a mug, right? I have a tea mug here. Some people have big mugs, some people have small mugs. A lot of people in our community have smaller mugs. So you look at your neighbor or your whatever, your friend, and they can get away with so much stuff. They're like eating whatever they want. They're like smoking. They're not sleeping well. They're like doing all the stuff that you never would dream of doing because you couldn't do it. But the reality is that you can't change your mug size. That's your genetic tolerance to these things. So when we look at methylation gene SNPs or endocannabinoid, the way that your body regulates the endocannabinoid system, there's different gene variants specifically in the gut that make people more sensitive to foods, et cetera. Looking at detoxification, gene variants, all of these, that's your cup size, that's your mug size. But you can determine what you put in the mug. That's all the stressors. So EMFs is like another ingredient in the mug. So once that starts overflowing, and that's where the flare-ups happen and the detox reactions happen. So my job is to determine the mug size by looking at genetics and like the other components. But then more importantly than the mug size, it's what's in the mug. So EMF is part of that some people can get away with all the EMF exposure and you're not noticing it in having a detrimental impact on their life. So I don't want to make it to be like the scary boogeyman for everybody. But for a lot of people that are already stressed out, meaning that they're already going through health problems, it can really stress out an already stressed out system. And some people, they notice it so clearly in their life that when they're exposed to it, it's just this constant aggravator to their immune system. Some people, it's not going to be that noticeable. It's really an exacerbation of any of their symptoms because we're talking about an immune system that's out of balance, and we are seeing either Th1 or Th2 sort of dominance there, and the body's in this hyperreactive inflammatory state. So if you had to go with the most common symptoms that I would say anxiety, depression, fatigue, like the mental health component of it, and a high sensitivity to like sound and light because their immune systems are just like taxed and they're constantly in this sympathetic fight or flight stress state. So that's the most common one, but I don't want to limit it to just that because it really could be any symptom that you have that's just aggravated when they're exposed to these things. How does it